Hi, everyone. We'll give everybody a few moments to jump in and allow participants to join this webinar. All right. Just in the interest of time, I'll go ahead and get started. So hello, everyone. My name is Brianna Montgomery, and I would like to welcome you to the Autism Intervention Research Network on Physical Health, the AARP February 2023 webinar. Thank you all for joining us today. Because of the number of participants, your audio will be muted throughout the call. However, you can submit questions at any point during the presentation via the Q&A feature or in the chat box on your webinar console. Just a friendly reminder to please be respectful when communicating in the chat and asking questions, and note that only questions or comments pertaining to the presentation will be addressed. This entire webinar is being recorded and will be available on the AIRP website, which I will put in the chat momentarily. You may also, You might also view presenter slides to follow the presentation on our Google Drive archive. There will be a short evaluation survey at the close of the webinar. We invite you to provide feedback on this webinar and also to provide suggestions for future webinars. In the interest of time, let's get started. Next slide, please. Thank you. We first want to acknowledge the Health Resources and Services Administration as the funding source for the AIRP. It is my honor to introduce our presenters for today. Next slide, please. Ali Tashi and Danielle Hall. Ali Tashi is the Director of National Programs for the Autism Society of America. Ali holds a master's in leadership and organizational development and a bachelor's in exceptional education. She has served the autism community for over 16 years as an educator, advocate, learner, and leader fueled by coffee and fierce passion for disability justice. Raised by an autistic single parent, Ali's foundational connection to autism continues to guide her as a parent, friend, professional, and ally. Ali lives in Wisconsin with her nature-loving family. When her adventures in parenting pause, she loves reading, live music, dark chocolate, and great conversations with friends around a campfire. Danielle Hall is the National Program Manager for the Vaccine Education Initiative at the Autism Society. Danielle has a master's in social work with an emphasis on public health. She brings more than 20 years of experience in planning, designing, evaluating, and managing programs to promote health, equity, and access. Danielle lives in New Jersey with her husband, 2 girls, and Cocker Spaniel. Please join me in welcoming Ali and Danielle.
Thank you so much, and thanks for having us present today on the Autism Society's Vaccine Education Initiative. Our initiative is to increase vaccine education, confidence, and access. And we're happy to be here to share our program, highlight key themes, bright spots, and our vision for the future.
Before we jump in, I wanted to just start with a brief overview of the Autism Society for anyone who might be unfamiliar. And recognize that we might have a new look, but we are the largest and oldest grassroots autism organization in the country. We've been serving since 1965. And you might be wondering what happened to the puzzle piece, hopefully celebrating, yay, the puzzle piece is gone. But we really went through the process of listening and learning and honoring the sentiments of I'm not a puzzle, I don't need to be solved, I'm not a problem that needs to be fixed. I'm a human that needs to be supported. And in 2021, we had our new brand that honors the sentiments of those in our community and recognizes the interconnectivity of threads that shows really the strength and community, equity, diversity, all fueled by connection. It is our mission to create connections in the autism community to empower everyone with the resources that they need to live fully. And we do that through our network of over 70 affiliates across the country. We serve over 500,000 people each year through education, advocacy, information and referral, support services, and community programming like the Vaccine Education Initiative. So as a national network, we are locally rooted and really are driven by the fact that within the autism community, no 2 experiences are the same. However, one experience that continues to be shared is the reality of barriers to accessible healthcare. And we designed the Vaccine Education Initiative around that need. as we go through today, we recognize that it was COVID-19 that brought us to this place. The pandemic continues to teach us new ways and shed light on the ways that those with disabilities are disproportionately impacted. And with 1 in 44 children receiving an autism diagnosis, and just the growth of neurodiversity as we're learning more about the different barriers that folks are facing in communities, we also recognize the increase in co-occurring medical conditions and the increased risks that folks face during the pandemic. So more than ever, it's critical that we are prioritizing health equity within the autism and disability community. And a lot of attention is spent on social determinants of health. We really focused around the fact that in addition to those traditional social determinants of health, the autism community faces unique barriers based on stigma, based on sensory and communication and social differences that aren't understood or supported. And too often, these barriers are framed as patient barriers, when in reality, they're environmental barriers, resource barriers, training barriers, systems barriers, and status quo barriers, all which contribute to the largest barrier of trust, those pervasive trust issues. And in order to really realize health equity, we have to reframe those barriers and recognize our collective ability and our responsibility to identify the solutions that create access.
So the Autism Society was the first national autism organization to respond to the COVID-19 crisis in March of 2020. We developed a COVID-19 relief toolkit and plain language resources, social stories, to explain COVID-19 related topics and scenarios. And then in 2021, with the support from the AUCD, we established a vaccine education initiative, a tailored public health model designed to provide vaccine education, inspire vaccine confidence, and improve vaccine accessibility within the autism community. So we began by listening to those who we serve to better understand our community's need related to vaccine education, confidence, and access. So the VEI, as we call it, was served as a pilot program across 12 affiliates in 8 states: California, Colorado, Virginia, Kansas, Wisconsin, Louisiana, Ohio, and Texas. And these pilot sites represented rural, urban, and suburban pockets of the country, including areas with the largest percentage of under-vaccinated populations. So we're going to start with our confidence messaging. Our confidence activities were designed to empower individuals to protect themselves, their loved ones, and their communities. And we inspired vaccine confidence through the national and local efforts. We did social media campaigns. We provided support group topics, we provided education and resources, and we attended community engagement events to disseminate our materials. We also provided our affiliates with educational slides and speaker notes to implement vaccine education programs locally and virtually. Our trained vaccine ambassadors included healthcare providers, self-advocates, public health messengers, and other trusted community leaders. So some of these topics included autism and COVID vaccines, what do we need to know? Increasing accessibility to vaccines, what are some considerations for healthcare providers? Addressing vaccine hesitancy and responding to misinformation, what parents need to know, and understanding boosters. Our educational series evolved as all of the guidelines continue to evolve as each age group and boosters were released. We equipped our affiliate leaders with public health strategies and messaging to engage those who raised concerns, and often they were the strategy. Together, we were able to create safe spaces for the conversations within the strong circles of trust and support that the Autism Society has been cultivating for over 57 years. And we empower the autism community to be health advocates. Here's a picture from a clinic in New Orleans, and we did an I Got Vaccinated Because campaign. And nationwide, this campaign showed participants at vaccine clinics with signs saying, why did they get vaccinated? And it was really a touching and beautiful tribute. Some said to see my family, to stay healthy so I can get back to life. And this was used through all social media outlets. We also promoted the vaccine education within the autism community so that all individuals, families, and caregivers have the knowledge that they need to make informed decisions. Introducing Dr. Emily Hotez, who has now become such a great ally for us, and we're so fortunate to be here in part because of her introduction. We educated through our national Facebook Live community connections featuring experts in the field and the autism community. And these broadcasts garnered thousands of views, and we were able to really listen to our community and deliver topics that they wanted to hear about in both English and in Spanish. So some of the topics included COVID-19 risks, accessibility, vaccine safety, pediatric recommendations, and then featured vaccine ambassadors within the autism community.
The CDC and the AUCD provides fantastic resources, trusted messages, and important updates that allowed us to connect with other leaders in public health and in disability advocacy and connect information to those in our communities. In addition to those resources and those that were shared by other partners in the grant space, we had an opportunity to create resources designed using the evidence-based practices that our community is used to seeing every day in their homes or in their classrooms, and those resources that our community was asking for. So as the VEI progressed, we grew our resource bank and continued to add new videos using fact sheets, different tips and downloading resources that could be used to prepare for vaccination or to support during a vaccine process. We developed social narratives, plain language resources, utilizing symbol sticks imagery. We partnered with the symbol sticks to be able to promote the images that our community is used to seeing every day if they're AAC users using Pro-Loco to Go devices, and recognized the ability for us to tailor these specific resources to each of the local vaccine clinics. We worked with our Council of Autistic Advisors and an AAC users group to develop communication boards along with letter boards to give additional insight to the ways that our community is accessing information during an exchange with a provider, as well as providing opportunities to talk about what to expect. And as we grew in our experience hosting the vaccine clinics, we were able to participate with local affiliates that were all saying the same thing. This is what made the big difference at the local vaccine that I held in this setting versus that setting. We worked with our pilot group to identify what were those high leverage, high impact practices that made a difference and that created access where barriers used to exist. So through our local partnerships, we provided this guide to accessible vaccine clinics, which supported pre-registration, provided social stories and visual schedules, communication boards, links to various sensory accommodations and other sensory supports that could be purchased when planning a vaccine clinic. And we utilized this as the beginning of our training for healthcare providers. One of the big things that we stress in talking about the VEI is the foundation of universal design. And in the middle of our work with the AUCD, my grandmother became sick. She was hospitalized and she had lost her access to speech. And it was in those early days where actually right here behind me, I had one of the earlier versions of our communication board. And I was able to utilize that communication board to be able to see what my grandma needed in that moment, if she was hungry or thirsty, if she was in pain. And that showed the beauty of these supports, which is the foundation of universal design, that what one person might need, all can benefit from. It's the foundation of UDL, it's the foundation of our clinics, and we saw it in action as young children who didn't have communication boards as a part of their daily life were using the boards to start conversations and ask questions. And as those AAC users were able to have something to communicate with their caregivers, with their care team in the clinics. And so by designing these clinics to meet the needs of those with autism and those with some of the most complex needs, we are removing barriers and creating access for a much larger population. Anyone that has social, sensory, communication, cognitive, and environmental differences and needs that aren't traditionally met are being served by the work of the Vaccine Education Initiative. In short, we've reimagined the vaccine experience and transformed to reduce anxiety at every stage. We've partnered with local frontline vaccinators, and we've trained healthcare providers in the use of new tools and strategies. The guide that we've provided has helped offer tips that can transform the vaccine experience way beyond COVID-19, and we're just continuing to learn about ways to improve our program and to connect more with those in the communities across the country. One of the ways that we've really connected with families and with providers is by distributing accessible vaccine kits. As a part of the research that we did within our own network, those practices that were high impact and high leverage were often resource related as well. So in addition to offering different pre-registration supports and using the social narratives and communication boards, the items that we put in our accessible vaccine kit had helped to make a difference for the local vaccinators and for those who went through their clinics. So we've put together these accessible vaccine kits for families and healthcare providers, and these are the things that start those conversations. These are the entry point to how can I teach you a little bit more about why this is important and how you can use this in your practice. In addition to providing the tools for families, we put together vaccine kits for healthcare providers and continue to hear from providers at our clinics. I was at a clinic at a children's museum, and a nurse had said to me, I've worked in peds for 25 years and I've never seen anything like this. And her sentiment was that not only should these things be in every clinic, but they can be. These are not hugely costly items, and the strategies that they were able to learn were things that they wanted to teach everybody in their clinic. So not only, should we do this, but we can do this are the sentiments. A couple of the specific healthcare tools that we have utilized in our kits are the Buzzy Bees and the shot blockers. And those are two of the resources that were new to us that are pain deferring resources. And these come along with our healthcare provider kits. But now a shot blocker is a little piece of plastic that I keep in my purse, and my kids use them as well during their vaccinations. Oh, here's my quote about the nurse. I apologize. I must have gotten my slides mixed up. This was the experience of the impact of this clinic. There's no reason that we aren't doing this in all of our clinics. Another piece of the Vaccine Education Initiative of our clinic model that is unique is the way that it supports everyone in the family. In addition to vaccinating children and adults with autism, we also had siblings getting vaccinated. We had parents and caregivers getting vaccinated. And the model that we had allowed the whole family to go through together. We continue to take a really comprehensive approach to expanding access and recognizing that the burden of scheduling families to travel to separate appointments is oftentimes a barrier in itself. Some of the feedback that we've gotten from families really pays tribute to the barrier of stigma that we talked about earlier and how that was removed during this type of environment. Getting this done in a low stress, guilt-free environment was great. It alleviated my own stress as a parent about being judged for my child's behavior. I appreciate the patience my children were shown, and getting to play afterwards helped create a more positive memory of the event, which will hopefully help the next time a vaccine is needed. This clinic was a game changer for my family.
Okay, so Allie and I have been fortunate to support our affiliate leaders and attend the VI clinics across the country, from Wisconsin to Texas. We went to Houston, Austin, and then we went to Akron, Ohio, and New Orleans. And we had the opportunity to see how powerful and how important and how successful these clinics can be. So we wanted to share these special moments with you. We created a PSA to highlight the impact that we can have when communities really work together.
The ongoing impact of COVID-19 is felt by us all. People with autism are more likely to experience severe symptoms and complex barriers to healthcare. Individuals with intellectual disabilities are also 6 times more likely to die from this disease. We see you. We understand the unique challenges the autism community faces. The Autism Society is committed to vaccine education, confidence, and access through our Vaccine Education Initiative. Together, we are reimagining the vaccine experience. We prepare, educate, move, respond, and support.
I got my vaccine today, and I
Visual schedules and social stories prepare vaccine recipients.
Today at the vaccine clinic, it was my first experience using social stories, communication boards, and visual supports to help ease the children's anxiety and help prepare them to receive the vaccines that they needed.
Healthcare providers receive training to facilitate a supported experience. Because of this, our vaccine clinics have a 99% success rate.
This was a successful vaccine experience because of the healthcare providers here, the play therapists, the accessory supports used for the injection sites, being in their own environment. It made it very welcoming and comforting.
Another great thing we've been able to do with the clinics is offer parents the option to do a drive-in. So they don't even have to come out of their car. We can just pull in, they call us. Our public health workers have been amazing and just gone out. We've talked to the parents, done everything, gotten the shot, and they're done in minutes.
Because of the strength of our affiliate network, we have hosted over 50 educational events and 30 vaccine clinics across the country. Because of you, we continue to advocate for a more inclusive, supported healthcare system.
I could not ask for a better experience. It's for all people. All kids can benefit from this.
The toys, to the stickers, to the snack bags, to even the shot blocker made a huge difference in making the experience of getting a vaccine so much more calm and a positive experience.
It made me feel a lot more like I was at a friend's house rather than getting a shot. I wish I could get all my vaccines moving forward like I did today.
The Autism Society of America is charting a path to improve health equity to ensure that the autism community and their families have both the access and the opportunity to obtain full health potential.
Together, we can be the connection. The Autism Society. The connection is you. Get connected at autismsociety.org.
Okay, thank you. So to reflect back on the work that was done by our affiliates in their communities across the country, we identified the pilot accomplishments. So we educated the community about safety and accessibility. We offered drive-through and sensory-friendly vaccine sites, as you saw through the video, really preparing participants for the vaccine experience and promoting the Disability Information Access Line. We also encourage communities to meet diverse needs. So really to increase tools to support health advocacy, including those communication boards, those visual schedules that Ali showed before, and increase community understanding of autism, accessibility, and inclusion. Finally, we've also created connections through many community partnerships. I believe we've had over 100 new connections through this pilot. And we really were able to transform the vaccine experience, not just for the participant, but for the healthcare professionals and everyone involved. Through this program, we were able to build trust, confidence, and promote inclusion. Our impact over a 6-month period, we vaccinated over 400 participants. We distributed over 2,000 vaccine kits, over 500 testing kits. We have attended over 30 educational events and trained over 500 healthcare professionals.
We continue to learn valuable lessons as we engage autistic kids, teens, and adults in this process, along with their parents, their caregivers, their loved ones, and their local public health leaders and healthcare providers. One of the biggest surprises in this work was our own miscalculations surrounding vaccine hesitancy in the autism community. Long before COVID, the autism community has been battling against misinformation related to vaccines, and we were prepared to face a lot of misinformation in our local communities. We leaned in and heard again and again from parents who were vaccine hesitant that they weren't vaccine hesitant because they didn't trust the safety or the efficacy of the vaccine. It was instead because they were unwilling to put their child through a 4-point restraint every time a medical needle was involved. And they were unwilling to sacrifice their mental health related to the long-term trauma impacts that those traumatic vaccination experiences can have. That kept coming up again and again and again. And we realized that that was a big barrier to providers discussing the vaccine with patients, because we heard from providers that when they saw a patient who had autism and was also unvaccinated, they made the assumption that their family was anti-vaccine. And so they didn't address the real barrier, the barriers to the vaccine experience, to getting the vaccine that they did want for their child. And we heard again and again that if all of the clinics that had vaccinations went like these clinics have gone, then their child would be fully immunized. We learned so much about the importance of collaboration and partnerships. We had volunteers locally, play therapists that supported our clinics. We worked with public health departments. We worked with nurses from different healthcare systems, and we worked with local community leaders in neutral environments, places like children's museums, as well as coffee shops and other, outdoor events, resource fairs, back to school bashes. We found that so often we all had shared goals, and everyone had a lack of confidence in the experience, and that by providing supports to both patients and families and providers, we could really create community engagement, comfort, and preparedness that went beyond meeting the needs of the autism community, but opened up inclusive health access for those with other disabilities, for those with various anxiety and trauma responses, and really grew opportunities to learn about how we can continue to make improvements to these processes, and to continue to design supports that gave tangible tools and practical strategies that made an impact.
So our expansion for 2023, we're in year 2 of the VEI, and we're expanding beyond just the COVID-19 vaccines, with a new goal to impact vaccine uptake in the autism community with a targeted focus on underserved and marginalized populations, including the aging and disability community. We'll continue to build on our local and national collaborative partnerships with pharmacies, Medicaid and Medicare and insurance providers, local health departments, vaccine coalitions, advocacy groups, and more to expand our work. We'll also focus on healthcare professional training to address barriers in vaccination. And in April, for Autism Acceptance Month, we will be launching a set of 5 healthcare professional modules through a collaboration with the Children's Hospital of Philadelphia that will be accessible to everyone online and free of charge.
We know that our work is far from over. The Vaccine Education Initiative allowed us to increase vaccine confidence and accessibility during a time when the country needed it the most, but we've unpacked vaccine hesitancy and worked to repair trust in local communities that propels us forward. We've identified key gaps in healthcare training, education, preparation, and provider confidence. We've found passionate people in every community that we serve, and we've strengthened collaboration, partnerships, and connection across the country. We've engaged with vaccine champions, such as the American Academy of Pediatrics, Immunize.org, the American Pharmacists Association, you all at AARP, and others. And these partnerships strengthen our programming, our community, our reach, and empower us to give the providers and their patients what they need to support a future of accessible healthcare. With over 70 affiliates across the country, the Autism Society of America recognizes our opportunity for continued impact. And as Danielle said, we're expanding to our affiliates across the country in 2023. We aspire to address the key challenges that autistic individuals face across the lifetime and seek to create connections that bridge the gap to ensure everyone in the autism community has access to the information, resources, and support they need when they need it. We invite you to engage with us, ask us questions, give us ideas, and connect with local affiliates along the way, because if we work together, we can be the connection to health equity. With support from the AUCD, we plan to continue to provide accessible and adaptive vaccines across the country, and we're looking forward to hearing more about the great work that other partners are doing across the country, because we believe in the power of connection. Thank you so much for everyone who is here today, and so much to the AUCD network and to AARP and Emily Hotez for all of the wonderful partnering that you've all done. We invite you to ask us any questions now, and I'll stop the screen share.
Yes, I'll just jump in real quick and say thank you again for your presentation and your work in this area. We do have time for questions and answers, so we can begin with those that are already submitted, while others think of some additional questions. I also will screen share in the meantime and invite you to our next webinar, which will be, on March 21st. Okay. All right. Sorry about that. And then the first question that we have is about how can an organization order the vaccination kits?
I was just typing and then my screen went like, we're going to add our email for the VEI program. It's vei@autism-society.org, but I'll add that to the chat box. And right now that is orders are being taken, and we're working with our local affiliates first to see who needs a kit, and if we have any local affiliates. We're actually working to expand the assembly and the distribution of those kits to also support employment opportunities for autistic individuals in our local communities. So I'll add that to the chat box. Oh, I think it just went to host and panelists, sorry. I don't think I can send a chat in the chat box to everyone. So if a host wants to copy and paste the VEI email.
Yes, let me go ahead and send that over to everybody. Right, we'll give a few more moments for you guys to think about any questions that you would like to ask our hosts. Otherwise, you do have their email to reach out with other inquiries. And if you would like to fill out our survey for after this webinar and follow us on social media, that would be great. This recording will be on our YouTube channel in about 24 hours. So that is all. Then I'd like to thank you so much, Danielle and Ali, for being here. And thank you all for attending. We'll see you next time.
Thank you, everyone.
Thank you.
Thanks, ladies. We'll see you next time. Have a great day.